Last but not least, we're excited to present the Social Work Agency of the Year Award. We have a video we will now play from Mary Matson, VP of Finance at NASW-Michigan, who will be introducing the Agency of the Year.
Good afternoon from Detroit, Michigan. My name is Mary Matson and I serve as the Vice President of Finance and Budgeting for the NASW-Michigan Board of Directors. And it is my great honor today to introduce the winner of this year's Social Work Agency of the Year Award. This award recognizes the outstanding accomplishments of an organization that employs social workers and has demonstrated contributions to the profession as well as in the community it serves. Today we celebrate an agency that has been a model of excellence in social work since 1912. Yeah, 1912. This year's winner has shown exceptional dedication to their clients and has created innovative care models that truly make a difference in their lives. They have established a wide range of programs from providing services to students in 16 school-based clinics in Washtenaw and Genesee counties, to providing gender-affirming care and the Comprehensive Gender Services Program. They have also established a new first-of-its-kind health equity consultation service to address inequities in healthcare access and delivery. This agency is leading the way in establishing fair pay for social workers by creating a salary model to support more equity and compensation. They are also one of the largest training sites for the next generation of social workers, providing field placements for 60 MSW students and 9 postgraduate fellows each year. One of the most impressive accomplishments of this agency is their implementation of screening, assessment, and intervention for social determinants of health for the 64,000 patients the department touches every year. Their dedication to promoting equity, diversity, and inclusion in the field of social work is truly inspiring, and they serve as an exemplary model for other organizations to follow. It's my great pleasure to introduce this year's Social Work Agency of the Year Award to a truly deserving organization, the Michigan Medicine Department of Social Work. And without further ado, I'd love to welcome to the stage to accept this award, Jason Schwartz, Aaron Kang, Amy Rad, and Susan Radzilowski. Congratulations to you all. Thank you for the great work you do.
All right. So my name is Jason Schwartz. I'm the Director of Social Work and Spiritual Care at Michigan Medicine. And first I want to correct an error that I made. It's Amy Jacobs, not Amy Rod. We have an Amy Rod in our department, but it's Amy Jacobs here with us today. So I'm very honored to accept this award on behalf of the Michigan Medicine Department of Social Work. I've been a social worker for nearly 30 years, and I've been very fortunate to work in some very special places and to be part of some very special teams doing excellent work under difficult circumstances. I'm proud of my career and the social workers I've been lucky enough to be associated with, and I've really only been with Michigan Medicine for, it'll be a year next week, but this place is exciting in ways that are new and very special. First of all, as was mentioned, the department has been around since 1912. I mean, that when I arrived was shocking to me that it had been around that long. Second of all, we're a very large department. We've got 292 social workers. You know, we do, and to have a department of social work is not the norm within healthcare. I came to Michigan Medicine from another healthcare system that did not have a department of social work. So social workers are scattered throughout the system and reporting up through chains of command that don't involve other social workers, that know our values, our ethics, and our scope of practice. So I'm grateful to have found that at Michigan, and it ought to be the norm. The introduction stole some of my thunder, bragging about all the great things about, about Michigan Medicine. But, so I won't repeat all that. But I can't think of another group of social workers doing so many different things in so many different settings with so many different populations. And I'll give you a few quick examples of some of the things that I think make us special. So for example, yesterday, I had to step out of the keynote yesterday morning to talk to the social worker who leads our Office of Decedent Affairs. I never imagined that I would have staff in something called the Office of Decedent Affairs, but we do. And we had a very large Muslim family that had just lost a loved one very suddenly, And to make matters worse, the body was moved from one hospital to another without notifying the family. So they finally found their way to Michigan Medicine, and they had to wait for the medical examiner to decide whether or not an autopsy was going to be necessary, and the family didn't want an autopsy. So I was working with the social worker on figuring out a plan to make sure that this family got viewing as quickly as possible, and to make sure that they were treated with compassion and respect in a culturally appropriate way. And this is not an easy thing to pull off in a very large institution with a lot of disciplines and a lot of departments that have their own way of doing things. So that was a proud moment. And also, we don't have to look any further than this stage to get a sense of how remarkable this department is. So Amy Jacobs, not Amy Rod, which was my error, she's worked in the area of HIV and AIDS for nearly 20 years, and she's a leader in that space. She presents all over the country, serves on 2 national boards, and on a regional council in Michigan. And this is Susan Radzlowski. She's active NASW members may be aware of her leadership in the ethics committee. She works in our child and adolescent gender services clinic, and for more than 15 years, she's been an important leader to assure that trans kids and their parents have access to competent and compassionate care. She's been involved in training thousands of professional helpers in all disciplines in pursuit of that goal. And this is Erin Kong. She's been a social worker specializing in nephrology and transplant care for most of her career, but she's also been a leader in social work, field education, interdisciplinary education, and DEI work. That DEI work led Erin to being integral to the establishment of Michigan Medicine's Health Equity Consultation Service. This service is believed to be the first of its kind and accepts consult requests from faculty, staff, patients, and families who feel a patient's care may have been affected by bias, inequities, or perceived discrimination of any kind. Erin made sure that social work played a lead role in to help navigate this service through the pilot phase, and she's also, the service has just exited the pilot phase and is now a permanent service at Michigan Medicine. So as social workers, turmoil is our business, right? But there's an exceptional amount of turmoil in the healthcare industry at the moment, which makes this recognition even more special and even more appreciated. Thank you.